Okay, so this week's module is on somatic symptoms and related disorders. And I think it's important to start with really first talking about the definitions of what somatic symptoms and related disorders are. So somatosensory sensation can be viewed as very subjective and objective in their own right, because we all perceive pain differently. And I want to repeat that. We all perceive pain differently. So subjective and objective reports of pain are going to be very specific to the person reporting that pain. So pain is defined as a physical suffering or discomfort caused by illness or injury. So pain is a reaction. Can be a positive thing. It's a reaction to some kind of physical, biological, or emotional trauma that disrupts the harmony of our everyday life. And it can be a good thing, as I said. So it saves us from an acute injury. But pain can also turn into something that's more maladaptive, where we're not able to function in our everyday capacity based on our subjective or objective interpretation of pain. Now, somatic symptoms are a classification of mental disorders that are distressing or that result in a significant disruption of daily functioning, as well as excessive and disproportionate thoughts, feelings, and behaviors, regardless of medical etiology, and this usually is for greater than 6 months. Somatic symptoms are how the body, how the brain, how the emotions are interpreting pain based on some sort of event that are very much out of proportion to what the original cause of the pain is. Now, there is the other part of that is somatic symptom disorders is sometimes the symptoms are not really fully explained by the medical condition. Let's say somebody stubbed their toe, for an example, and the pain has become so great that they're now no longer able to walk. So the root cause of the pain does not match the outcome of the pain. There is another type of somatic sensory disorder that is a factitious or malingering disorder. And malingering is the intentional production of false or grossly exaggerated physical or psychological problems. So we need to really be clear the differences between these three components. So there is pain, physical suffering, everyday discomfort caused by illness or injury. We all perceive it differently, and the subjective and objective information is going to look different for everybody. There are somatic symptoms, which, based on some form of reaction to physical, biological, emotional trauma, it is classified as a medical disorder or a mental disorder. The symptoms do not match the root cause. Very much often the person who has these somatic symptoms, they're not able to control, these exaggerated presentations. Now, on the other side of that is malingering, where it is intentional. It is purposeful. There is an ulterior gain. But we have to be very clear when treating and working with these clients that we are treating them fairly and without bias. If it's malingering, there is a root cause. We have to really consider how we interact with that client to not be disdainful or mistrusting, and to help facilitate the team to help figure out, what the root cause is, what the purpose is, and to, get the client out of the therapy services based on that malingering. The somatic symptoms are definitely going to be treated differently. You really want to treat those symptoms as if the patient really has those symptoms. And we're going to kind of go at it from a more therapeutic interventions in conjunction with psychology. So, with all of that being said, how is occupational performance impacted? Well, we can imagine that all areas of client factors, all areas within the framework, occupation, context, performance patterns, performance skills, they're all going to be impacted based on the reason that you're seeing the client. So to best understand the impact of somatic symptoms and related disorders on occupational performance, we really need to understand the impact of the pain syndrome and the perception of pain that the client is having. When we think of pain, it's easy to understand the cause and impact upon the client if it's associated with an acute injury or surgical procedure. But after the bodily structures heal and the pain remains, the perplexity related to the etiology of the chronic pain is unclear, and then the impact on occupational performance can be hard to understand. So if we just very broadly look at maybe occupation and how occupation is impacted, if the pain is more physically limiting, then we can see where all areas of occupation and occupational performance are impacted. Because the perception of pain, the subjective, objective reports of pain, it can be, it's so great, it's not well controlled, and it can impact all areas of occupation. Now on the other side of that, the malingering part of it, again, we need to understand that this is for some sort of ulterior gain, and we need to understand what that gain is to then effectively treat and manage the person with that diagnosis. But again, we don't diagnose somatic symptoms, and we do not diagnose malingering. This is a team approach working with these clients. And that's information that really needs to come from the doctor, and we don't name those things to the client. I hope that helps. Don't hesitate to reach out.